Welcome to this presentation to talk about case 14, 20, 17, 20-year-old man with pain and swelling of the left calf and purpuric rash. Okay, a 20-year-old man was seen in the outpatient clinic of the hospital because of the pain and swelling of the left calf and purpuric rash. The patient had been well until 3 weeks before presentation to his hospital when sore throat, non-productive cough, rhinorrhea, and chills developed. He noted areas with rash over the next 2 days. The pain worsened in the severity and was associated with swelling of the calf.
Welcome guys, today we are going to talk about Henoch-Shoreline purpura, which is the most common vasculitis in children. It affects the children of age group of 2 to 8 years. How it happens is, it is followed by an infection that is usually going to be an upper respiratory tract infection. So to fight against this infection, our body will modulate our immune to protect us. In that process, that modulation of immune in protecting us from infection, it will turn against us and destroy our normal tissue. So it is called as a molecular mimicry. So in HSP, the affected tissue is going to be our blood vessels. So only it's called as vasculitis, which is the vascul means a blood vessel, and it is going to be inflammation by our immune. So by what type of hypersensitivity it affects is the type 3, that is the immune complex mediator, which the antigen antibody combine and deposit in our small blood vessels, and these antigen antibody complex will call the neutrophils, and by the chemicals from the neutrophils it is going to destroy the blood vessels. So if the blood vessels are affected, then the blood inside the blood vessels will get out by the gaps of it, so there will be a blood loss. The affected blood vessels are of our skin, so the patient will have palpable raised purpura lesions. That is going to be below the waist, that is on the buttocks and legs there will be. So the blood vessels in our kidney is also affected. So there will be glomerulonephritis. So even it affects the GI tract blood vessels. So there will be a GI blood loss is going to be there. So and there will be a intermediate abdomen pain, and it even affects the joints. So only there will be arthritis will be there, especially it affects the joints of weight bearing joints. So now when the patient walks in clinic with a bleeding, so we are going to order a CBC, right? So in CBC what we will find in lab test means there will be normal amount of platelets, and the patient will be having an increased amount of WBC and ESR. So as we know that it's going to be an inflammation disease, that is autoimmune. So there is going to be a increase of WBC and ESR, and you have to know that there will be no ANA should be found. For HSP, what we will find means the definitive is there will be increased amount of IgA antibodies. That is the most.
Henoch-Shoreline purpura is a systemic vasculitis characterized by purpuric skin lesions unrelated to any underlying coagulopathy, gastrointestinal manifestations, and arthritis and renal involvement, infiltration of small blood vessels with polymorphic nuclear leukocytes, and the presence of leukocytoclasia are typical pathologic findings in vasculitis. Henoch-Shoreline purpura is mainly a childhood disease in the most common type of vasculitis in children and infrequent conditions in adults. Application in medicine has reported informing studies on adults with primary cutaneous vasculitis, drug-intake history, and upper respiratory tract infection before the onset of the vasculitis were considered precipitating events. These events were considered to be present if there was a close temporal relationship between the start of drug intake and the onset of the Henschel purpura, or if there was a URT infection shortly before the onset of the disease, that might explain the occurrence of the condition.
Phenol purpura. This disease is a systemic vasculitis characterized by the deposition of IgA immune complexes in the skin and other organs. This is the most common childhood vasculitis. Phenol purpura typically presents after pharyngeal and upper respiratory infections. In this disorder, the skin, joints and GI are most commonly involved. In the skin, immune complex deposition causes palpable purpura, classically on the legs and buttocks. Arthralgia and abdominal pain are commonly seen in phenol purpura. Involvement of the GI tract can lead to intestinal hemorrhage, which can present with black stools. Finally, phenol purpura is commonly associated with IgA nephropathy. So remember, phenol purpura is a systemic vasculitis.
Okay, pros. Henschel purpura may occur in all age groups but is much less frequent in adults. Henschel purpura is the most common form of vasculitis in children, with an incidence of approximately 18 cases per 1 million children per year. And Henschel purpura tends to be less severe in children.
A funny way to memorize it. Hennock-Schonlein purpura, HSP. H for hematuria. S, small child. P, palpable, purpura on the buttocks. I forget something. Hennock-Schonlein purpura. Purpura. This A is for IgA, IgA immune complex, IgA nephropathy. HSP, hematuria, small child, palpable purpura on the buttocks, IgA. So thanks a lot and
Okay, count. Children may rarely have intestinal obstructions, which are a potential complication caused by bowel bulging.
That's about it.
We'll have to see if I can pick it up on video. But and then what about any abdominal complaints, any blood or urine or anything like that at all?
She's been eating fine. She has no stomach pain.
Okay.
She's a little dehydrated now. That's
Okay.
why they give her fluids.
All right. Now, so are her feet and legs, are her feet swollen? Yeah, because these feet look
She's
like,
even got them on the bottom of her feet.
okay. Does that hurt to move your ankle?
Yeah.
I'm sorry, did I hurt you? You can kick, no, you won't kick me because it hurts too much, right? But, so her feet are swollen. They do look swollen. Her ankles definitely
Yes.
look swollen. And so as you know, basically, as you saw, I just barely moved her
Yes.
foot, and this caused her significant pain. What about her knees? Is she having any discomfort in her knees at all?
Yes, when she tries to walk, it's in her foot and her knees.
Okay.
In the back of her calves.
Okay, very good. All right. So she was admitted and then went home, and but because now she can barely walk, she's back.
Yes.
What grade in school are you? Second grade? Okay, how old are you? 7? Very good. I bet you're pretty good in school. Yeah, I can tell. I can tell when they're super smart like she is.
In Ecuador, Henschel purpura is an immunological disease associated with glomerations, different histopathological patterns, which can often be translated in clinical manifestations.
get a little closer to the rash and kind of show. What you can see here, obviously a very swollen leg, but what's different about some other swollen legs is there's no pitting edema. Pitting edema means when you push, it stays down. This edema, it doesn't really pit. And then the rash, the way to describe it is purpuric in color, and it doesn't blanch. That's why we know that it's probably micro vessel bleeding underneath the skin. And that's very characteristic of vasculitis. Cellulitis, if you see my other videos, it doesn't have these spots everywhere. It's more like a painting with a spray. It's more uniform. This separated are tiny little bleeding because of the superficial vessels. And the way we know that is because it blanches. If you were a kid with a fever, we would think about sepsis, DIC, which is disseminated intravascular coagulation. We think about meningococcemia, very ITP, which is idiopathic thrombocytopenic purpura, in which the platelets drop and you get bleeding everywhere. But this is just legs, which makes us think about vasculitis more than anything else. I'm going to go in a little closer here. So you can see here, there's no blanching of the rash. And that's how we know this is vasculitis. So this patient had a normal white count, normal kidney function, but her albumin was a little low, and her CRP was elevated. That's the C-reactive protein was elevated at 1.49, which means this is definitely something inflammatory and definitely a vasculitis.
Okay, conclusions. No significant difference in age at disease onset were found. Renal sequelae were not associated with the onset of the vasculitis in any season in particular. Also, a history or ERT infections or drugs before the onset of disease was not associated with the bad outcome. Thank you guys. Bye bye.